Mr. Speaker. On November 23rd, the Mental Health Review Committee provided the Minister of Health with recommendations to address Alberta's fentanyl crisis. The immediate action plan includes allowing all first responders to administer the life-saving fentanyl antidote. So to the Minister of Health, given that last week you told the Globe and Mail that you would make the change, quote, before the end of the year, unquote, when almost one person is overdosing on fentanyl and dying every day in Alberta, why would you wait even one day to save lives?
Mr. Speaker, and to the member for the question, it certainly is an issue of concern, and we want to make sure that we're acting quickly to try to get life-saving antidote into the hands of people as quickly as possible. That's why we've purchased and we are distributing an additional 2,000 naloxone kits across this province, but it's only one part of the larger solution. It would be a lot easier if the federal counterparts were in the same awareness as we are in Alberta. We certainly have work to do in collaboration, but we're doing our part provincially within the current legal legislation that we have to try to move it forward as quickly as possible, Mr. Speaker.
First supplementary.
Thank you. But that doesn't explain why the recommendations from the Mental Health Committee haven't been implemented yet. So given that as Minister you can immediately implement the recommendations of your own Mental Health Review Committee and no legislation is required for the 5 immediate action recommendations, and given that the committee has called upon you to display, quote, clear leadership and partnership, unquote, why have you not implemented the immediate action recommendations of your own committee? What are you waiting for, Minister?
Thank you, Mr. Speaker, for the question and the opportunity to address it. Now, doctors and specialized pharmacists can prescribe naloxone. All paramedics and pharmacists can administer naloxone in an emergency. We are fast-tracking regulatory changes so that other first responders can administer naloxone as well, including paramedics. And the Alberta Health Professionals Act is an option that we are working on, and we want to make sure that we get the right answer moving forward. But, Mr. Speaker, we are working hard to make sure that we get the antidote into the hands of people who are likely to abuse. And that's one of the reasons why we're working to invest in these additional 2,000 kits. But it does take time, and in the meantime, we're doing everything we can, Mr. Speaker.
Second supplementary.
Immediate means now. But so to the same minister, given that this government is wasting no time in pushing through legislation for 331 farm-related deaths from 2007 to 2014, and given that fentanyl is on track to kill that many Albertans this year alone, and given that for every day wasted, 15 so far, 15 more Albertans may have already died, why are you not reacting with the greatest urgency to this crisis?
Hear, hear. Honourable Minister of Health.
Thank you, Mr. Speaker. The piece around having other first responders be able to administer naloxone is the one piece I was speaking specifically to. With regard to addressing this, we have certainly increased public awareness. We're improving addiction treatment across the province. We've created a fentanyl response team that is pulling the right people around the table, and they are connecting on an almost daily basis, Mr. Speaker, around what's happening in different parts of the province, as well as reducing the supply and trafficking of the drug. We take this very seriously, and we were doing everything within our own authority to be able to move forward on this. The federal government has legislative authority over prescription drugs, so that we're trying to make sure through information that we're urging them along around